Good morning, everyone. Today we are going to tell and discuss about some important things which we should take care when we are planning for a pregnancy. Well, this is such a beautiful event in a woman's life, getting pregnant and giving birth. Yes, if we are planning for pregnancy, there are some important things which we should always keep in mind. Firstly, if we are having any medical condition, for example, epilepsy, thyroid, sugars, or any other medical condition, it should be well under control. So it's very important that we visit our specialist and we do the dose regulation. In case we are taking any medications for any particular chronic problem, it's important that we check from our specialist that this medication is safe to be taken during pregnancy and this is not teratogenic. Teratogenic means it is not harming or causing any birth defects in our baby. Before pregnancy, it's very important that we optimize our BMI, that is weight to height ratio. So normal weight to height ratio is between 18.5 to 24.9. So as far as possible, we should be in near this range. It's important that if we are using too much, if we are drinking too much of coffee, we just cut down our coffee, because definitely caffeine is also known to have negative impact on our fertility. Smoking is totally not advisable before and during the conception period or even during pregnancy, because it has so many harmful effects on the sperms, on the eggs, and it drastically lowers down your fertility levels and also is known to harm your baby. Similar is with alcohol. There is no safe limit to alcohol consumption, and yes, alcohol consumption during pregnancy is known to cause many birth defects. What vitamins we should consider and what other things we should take care of? Well, it's very important that if we are planning for pregnancy, we should start 5 milligram of folic acid at least 3 months before our conception. Folic acid is a form of vitamin which is known to prevent certain birth defects in the baby, particularly the neural tube defects. By neural tube defects, we mean spina bifida, anencephaly, meningomyelocele, and cephalocele. So these are some of the birth defects which folic acid rarely prevents. Other vitamins which can be given before the conception is vitamin D. So the dose recommended is 400 to 800 international units per day. It's very important that you are aware of your fertile period. So normally the dominant egg, it is released from the ovary if you have regular 28 to 30 day cycles. So it's released from the ovary on 13, 14, 15 day, and the lifespan of this egg is 24 hours. So it's very important that if you are planning for a pregnancy, you have timed intercourse during that period. What is easy to do is that you can have sex every alternate day in your mid-cycle days. It's very important that if you are planning for pregnancy, you should have a pre-pregnancy counseling as well. Discussion with your gynecologist, what important things you should take care of and what certain tests which really needs to be done before pregnancy can be taken care of. Knowing your blood group, complete hemogram to know your hemoglobin levels, screening out for thalassemia, seeing that you are immune to rubella, and looking for certain medical problems like thyroid, sugar is very important before you try to conceive. So these are some of the basic tests which really can be done. And if you never had your pap smear in the last 3 years, it becomes important that you have your pap smear also before you plan a pregnancy. I hope this video was helpful to you. Any queries, you can just text me. Thank you for your time.